Good afternoon, ladies and gentlemen who have joined us on this Dr. Fundi channel via multiple social media channels, Facebook, YouTube, Twitter, Instagram, and also the Dr. Fundi website. My name is Dr. Fundi Lenyati. I'm a family physician, but today I am here wearing another hat of just being a host on this channel. Today, we have a very interesting conversation in prospect. As you know, during this month of August in South Africa is called the Women's Month. This is a month where we celebrate women of South Africa, the good things that they have done, starting with those women in 1955 who marched to Pretoria to challenge the apartheid government. But we have learned from those, but we now need to look at the women of today, the women who are doing great things about the challenges of today, the women who are preparing South Africa to be in a better position to deal with the challenges of tomorrow. So since the 1st of August, we have been featuring, some of our female compatriots who have done great things. And today we have one of those, Mamuruti, Dr. Boitumelo, Precious Phakathi. She is our special guest today. So I'm going to tell you a little bit about her, but she's got a very long profile. She intentionally gave me just 2 lines about her profile. So I decided I'm going to go and research her because she is somebody that everybody needs to know about. So let me tell you a little bit about our special guest today. I've already mentioned to you that Kimamurut. So, right. So she is a pioneering, visionary, very ambitious, high-achieving clinician scientist who is a qualified specialist surgeon and was the youngest specialist surgeon in South Africa when she qualified as a surgeon. She was only 29, and that was in 2014. So you can add, 7 years to that 29, you'll get to where she is at this moment, right? She is actually a multi-award winning trailblazer for her pioneering research work in her area of interest, which is cancer of the breast and the HIV. Just this year, in fact, about a month ago, on the 9th and the 10th of July, she was a recipient of an award, a research prize at the 48th Surgical Research Society of Southern Africa, SRSSA, for her groundbreaking work on molecular biology of breast cancer and HIV. And when she posted about that in her own Instagram page, on the Rafa Breast Healthcare page, she said, it's important to understand the molecular biology of breast cancer and HIV beyond just treating breast cancer. All right? It's important to understand the disease at a genetic and molecular level. This is what she put on her Insta page. So that's one of the awards she got just about a month ago. She also was recognized by the South African Health Excellence, committee that runs awards. She was a second runner-up in 2019. That's where I actually, got to know about her because I was attending that session invited by Professor Masime, who is the president of the South African Clinician Society. She's also a philanthropist who founded the Boitumelo Phakathi Foundation. that focuses on career development and advancement of youth, especially those who are from rural South Africa. Well, obviously, she comes from rural South Africa, from Taung in the Northwest. So it's no surprise that she's got some connection, with rural South Africa. She is a pastor's wife. She is a mom. She is a faith-driven, God-fearing woman. So you will understand how she navigates her life based on understanding just those, right? She's got many roles that she needs to juggle on any day. And as an academic within an academic complex of Wits University, she lectures and mentors and coaches undergrad students, medical students, and also postgraduate medics, supervising their master's, thesis, and she has a vision to one day be a vice chancellor. She didn't know that I know that. She would love to be a vice chancellor in the near future, and not getting that, just given to her on merit. All right. And in the meantime, she's on a mission to become a professor on merit again, based on her research outputs, based on her improving her teaching, profile, based on her teaching her leadership skills. So she's already done, an introspection and analysis of her strengths and weaknesses on what would take her to get there. And she has identified that the quality of scientific research outputs, the quality of leadership, and also, her impact in teaching undergrad and postgrad students should make her to be considered on merit to be a professor. And I think she's very close to that. She has published already in national and international reputable medical journals. And when one looks at, but what does she credit all this success to? She credits God. She credits her family support, especially hubby. But she also did something special. She credits her helper. She believes without the support of the helper, without the unwavering support of her hubby, and the family, generally, she could not have achieved many of the things that she has achieved today. So I think for me, what touches me most is acknowledging the hubby and the helper. Most people do not acknowledge the role helpers play in our lives, in helping us to balance our lives. She describes herself as smart, ambitious, humble, right? Obviously, lots of faith on the God of impossibilities. But I decided to add some of my own, that she obviously is a hard worker. She's very professional based on what I've read about her. She believes in meritocracy, not to be given things on a silver platter, but to work hard and earn whatever that is given to her. She's a serial glass breaker, and you will understand that a little, a few minutes from now. I think she's stubborn as well, because when she entered this field to train as a surgeon, entering into a space that is a male preserve, at least was. So many people told her, you won't even last 3 months, but you know what? 3 months came and it passed, and she continued, and she eventually became a specialist surgeon. So she's not the kind of person who just gets told, don't do this, and then she just doesn't do it. She's courageous. She ventures where others fear to tread. She's obviously a nurturer and empowerer, and that you can see at what she's doing for the up and coming female specialist surgeons. she wants them not to experience what she went through as one of the pioneers, female pioneers in the area of general surgery. I think she's in touch with her life purpose to make a positive impact to humanity. So the last I need to say about her is that having ventured into this previously and still male-dominated discipline of surgery, from day one, she has come face to face with the ugly face of patriarchy. And instead of allowing patriarchy to bring her down, she used it as rocket fuel to propel her to the top of her field of surgery. She just let her success, her work to do the talking. And she has kicked those doors that were previously closed wide open. And many women who have come behind her are now thriving because she became a pioneer. So she really lives the saying of lift as you rise. So Dr. Boitumelo Phakathi, welcome to the Dr. Fundi channel. I gave you a long introduction because I wanted people to know who you are. And some people, when I do this, then they develop the imposter syndrome, I hope, where they think, I know, this can't be me. All of these good things, no, it's not me. Those are all the things that we have done. Welcome to the Dr. Fundi channel.
Thank you very much, Dr. Nyati, and greetings to the audience.
Yeah. All right. How do you feel with so many things being said about you and you have not even reached 40?
Oh my goodness. Well, it's truly humbling. I'm glad to see that you've done your research because I only gave you 2 lines on my profile, but clearly you did your research. But what I can say is that it's truly humbling. Sometimes we don't even realize how much one has done. But when one looks back, you realize that I've been really busy. It can get hectic every now and again, but the idea is to keep pushing until you reach the finish line. Sometimes, yes, you do have these big goals, you do have these big dreams, and obviously you will encounter those challenges along the way. The key is to keep pushing until you reach the finish line. You do whatever it takes for you to get there, whatever it takes, which is legal, obviously, yeah, to get you to where you need to be.
Right. So in South Africa, we are in the month where we celebrate women, Women's Month. What does it mean to you this month?
Well, yes, it's really an honor that there is actually a time set aside whereby women are being celebrated. The significant contribution that women do, be it in their families, in their homes, even at work, they're being recognized. Obviously, this shouldn't be just something that gets done in August. This needs to be done on day-to-day basis. We know where we come from as the country. We know back in the days the things that women used to go through. So it's really humbling to have a time like this whereby we're being celebrated, and those who have gone ahead of us also, they're being celebrated, and we see the good that they're doing, because it's sometimes, you know, like in the journey, you tend to get discouraged, but then seeing those who have gone before you, the challenges that they have encountered and also overcome, that somehow does give us the courage that no, it can actually be done. If this lady could overcome this and that challenge, it means I can also do that.
Lovely, lovely, Doc. So before we get to the big things you've done, you know, as a doctor, as a surgeon, let's go back to where it all started in Taung. In Taung, yes. Right? Tell us a little bit about the kind of family that you came from, how many siblings you guys were at home. Are you the last born? Are you the firstborn, middle child? Yeah, let's just start there.
Yes, I'm from Taung 13, Taung in the Northwest. I'm from a small family. I'm the eldest, and I've got a younger brother. Yes.
So you are the parent.
So yeah, I'm coming from a small family. So the love and passion for doing medicine began in 1997. I remember at the time I was doing grade 7, and I met a lady, Dr. Sesane, who was actually the first female doctor that I got to know back at home. Because remember, it's a village, so you don't have a lot of clinicians there. So Dr. Sesane was there, and I used to admire her so much. And looking back, I'm still grateful that she opened that door for me when I came knocking to find out about this field of medicine. She did, despite her being busy, she did open a door for me, and she gave me her time. She listened to my questions, and she was able to advise me. So obviously I was still very young at the time, and the good thing is that each year the love for medicine started to grow, such that I decided to even visit our district hospital, Taun District Hospital, whereby I met other doctors like Dr. Nzombe. And for them, they were also like quite they were very selfless, because they were able to attend to me, answer all the questions that I had. So yes, the passion got developed. And then come high school, whereby now I had to choose which direction I have to take. So unfortunately, back in the days, the women were being encouraged to pursue careers in engineering, because there was funding, there was scholarship, there were bursaries for those who are pursuing the engineering field. But for medicine, there was none. So you can just imagine that it was not an easy journey. It was not an easy decision to make at the time, knowing that, yes, if I go the route of medicine, I may not have funding. But if I go the route of engineering, there will be funding. But unfortunately, like my heart was really not there. My heart was really not there, because at that time I had to ask myself that, will you be happy 5 years down the line? Yes, you're doing this because there's money. Will you be happy? Will this encourage you to get up in the morning and go to work, knowing that it's not really what you are passionate about? So then at the time the only thing that I had was my maths. So I told myself, I'm going to work harder. I'm going to work very hard, such that my maths, they market me. And I remember I did get scholarship. I did get 2 bursaries for engineering based on my matric results. But like I said, my heart was really not there. Yeah. When I got a phone call that I got NSFAS, I had to drop off everything and then pursued my passion, which is becoming a doctor, doing medicine with that NSFAS. And I remember one promise. Sorry?
Yeah.
I remember one promise that I made.
Yeah, just finish that part. I want us to go back a little bit, but just finish the part about NSFAS.
Yes, so when I got NSFAS, I was like, okay, yes, I know it's not going to cover everything, but because it's giving me the opportunity to pursue my dream, this is the way I'm going to take. And I made a promise to my mom that come my second year, I will be using a bursary. And that's exactly what happened. Thank you.
Lovely, Doc. So, but let's go back. You've just mentioned your mom now. I want to know, your early influences there at home. All right. So there was Dr. Sesane, who was one of the early role models for you, who gave you time, and other doctors at Taung District Hospital who also encouraged you. But let's go back to the home. What are the values and the principles, that were inculcated in you that are still your compass as you navigate life, professional and beyond today?
Thank you for that. So yeah, growing up as a young child, young girl, one thing that my mom instilled in me was the importance of fearing God, loving God, and having faith in God. The other thing is that I had to work hard. It was important that I had to determine which career path I'm going to pursue and focus on that. She encouraged me to work hard, to take my studies seriously, and obviously encouraged that, there are certain pleasures that you can delay, that you can delay for the sake of you passing and being admitted at the medical school. So working hard, fearing God, having faith in God, and obviously remaining humble, no matter how much what you achieve. Remaining humble, being kind to other people. And the other thing is that, even after you've succeeded, remember where you come from. Look back and bring others up. And this is something that I'm still holding on to even today.
Even today, yeah. And so As the firstborn child, normally parents, they practice parenting on you. So things tend to be a bit harder for firstborn children and a little bit easier for those who follow you. So how hard were they? Very strict on you as the firstborn compared to the other guys who came after you?
Like you say, I mean, my mom was so strict. My mom was so strict. I remember while in middle school, she once told me that I must just pray hard that she doesn't get called to school simply because I misbehave or I didn't do my homework. She was like, you know what, when I get called, I'm going to make sure that time they used to beat us up. I'm not sure.
Yes, corporal punishment was standard.
Yes, at the time, but now it's not, it's not allowed. And then just like, when I get there, I'm going to smack you in front of your friends while the entire school is watching. So that sort of helped with it, disciplining me, because whenever they say at school that do this, I had to make sure that I do what my teacher expects of me. I had to make sure that I behave, just because I just couldn't stand the thought of my mom coming to school and beating me up in front of everyone. And the same thing applied even in high school. So yeah, she was very strict. I think she started calming down a little when I was in varsity. When I was in varsity, but I'm really grateful for that.
Yeah, how would you describe yourself though as a child growing up? Yeah. If somebody from Taung is listening and watching, can they relate with what you're going to tell us now? What kind of child you were growing up? Teenagehood, adolescent. Before you actually went to medical school.
Besides being a hard worker, I was a little bit shy. I used to be very shy. Yeah, but like any other child, there is that element of being naughty. So there was that, but in overall, I'll regard myself as someone who was shy, hardworking.
Yeah.
And yeah.
Any involvement in sports activities in high school, or debates or things like those?
I was more involved in church activities. I joined the church choir from the age of 9, and I was essentially busy. Anything that had to do with church, you would find me there.
Yeah.
And obviously, being in a choir, it meant that you had to go attend the choir practice during the week. Sundays, you are there. So yeah, in terms of the sports, I was not really a sporty person, but I did do some volleyball in middle school.
Yeah. Okay. All right. So you passed your matric, and then you obviously wanted to do medicine. You had been, in your mind wanting to do that, and nothing changed you. Even being enticed with bursaries did not change your mind. You applied to which universities, and which one eventually accepted you?
So I did apply to UCT, and then UKZN, used to be called University of Natal at the time. So then when I got the bursary for engineering, UCT was one of the institutions that was selected by that company. So at UCT, then I changed for engineering, just like sort of as a backup. But then for medicine, it was University of Natal.
Yeah. Okay. All right. So you did your MPCHB in Natal?
Yes, I qualified in 2006.
Oh, lovely. Well, I was there, qualified in 1989. Many years before you. But at least there's something in common there, same alma mater. But that time you guys were in Howard College. You were no longer staying where we used to stay. All right. So when you look at your undergrad training, your time, at medical school, how was that transition from high school to medical school, being so far away from home, that is Daung?
Initially, it was quite tricky, scary, considering the fact that I've always stayed with my parents. It was actually the first time I left home, so you can just imagine the first few months they were quite tricky. And as a result, I used to find myself indoors most of the time, just doing my work. Because I remember one thing that my mom told me when I left home was that when you get to varsity, remember why you are there. Do not even forget where you come from. Do not even forget the social circumstances of your family. Yes, you'll go there, you'll meet people from other different backgrounds, other learners, students from rich background. So when you do meet them, don't forget where you come from and why you are there. So for me, obviously, I had to really focus on that. Okay, I am there to study to become a doctor. So that the first few months, that's what I focused more on. Yes, I did have some friends in class and also in the residence, but most of the time it will just be church and then books, school. Yeah.
Wow. Okay.
And obviously, as time went by, then you realize that, oh, okay, you know what? Life does not just evolve around books. You need to start thinking out of the box. But when you do that, still remember why you are here.
Yeah. So in your 6 years of study, you just cruised, no subs, record time.
We did a 5-year program. I was the second group. We're the second group to do the 5-year program. And it went smoothly. And I thank God for that.
Right. So of the of the many disciplines of medicines that you were taught there, was surgery one of those that you really enjoyed, or you actually discovered your love for surgery afterwards?
Actually, at med school, internal medicine. I love internal medicine, such that we used to buy this big Harrison book, editions. Because for me, I thought, I used to think that physicians are the most brilliant doctors. You just listen to the registrars answering questions, how much they knew. That I did like that. But then come to internship. Oh, I fell in love with surgery. I think surgery rotation was the best for me. And then that's when I started paying more attention to that and considering as something that I can pursue as a career.
What about surgery, though, that made you so interested during internship? And where did you do your internship, by the way?
I was in Calafong Hospital for 2 years in Pretoria.
Yeah.
The thing about surgery is that, yes, the patient will present with a surgical condition. You make that diagnosis, for instance, acute appendicitis. You take the patient to theater and you deal with the problem. In the next day, the patient can even be discharged. In a case whereby there is something didn't really go right, it is quick to pick that up and you are able to correct that. Whereas the problem that I had with other disciplines was that they are very good, though. Those disciplines are very good. I'm not speaking bad about them. I'm just referring to myself. Is that sometimes you find that you spend time trying to find the diagnosis, doing different tests before you can actually get to the diagnosis. So for me, it wasn't really for me. I needed something whereby, yes, I identify the problem, I deal with it, the patient recovers, or if there's something that has gone wrong, we are able to address it until the patient can be discharged.
Yeah. All right. So as you were talking there, I remembered, the diss that normally takes place between surgeons and internal medicine people, where others say, no, this thing of doing a battery of tests and going through and trying to zoom down to one diagnosis, which can take many days. As surgeons, we are action people. We make decisions and we stick with our decisions. We go and open where we need to open. And stuff like that. So I'm hearing you saying that, but yes, you actually said you're not dissing the internal physicians.
Yes, I love my colleagues.
But I understand what you're saying. All right, so you fell in love with it during your internship at Calafong, and then ComServe. Where did you do your ComServe?
I was in Brett's Hospital at the time.
Yeah.
In the Northwest. Yeah.
All right. So a little bit of taste of your home province, to do a little bit of something there. And by the way, I've got a question from Dr. Mukwera. There's a question which, please, you must note it. He wants to know, when are you going to go back and add value to your home province? So just keep that question aside. There's a second one, but I'll check it now and I'll give it to you. So he's the big dog of Northwest Bujanala district, and he wants you. But then Taung is on another area of of Northwest. So I'm not sure if he wants you to go that side, but that's a question that already has been posed by Dr. Mukwera. And if there are other people who've got questions, please, they must feel free to comment on our Facebook page or YouTube. We will get all of those questions, because this is not just, an interaction between myself and Dr. Phakathi. It's also important for other people to actually ask you a few questions about, your journey of success. So just park that question from Dr. Mukwera. All right, so you were at Brits, and then after you finish your ComServe, did you go back then to be a reg, or you spent some time as an MO?
After my com service, I went straight to Pretoria, and luckily I got a registrar post from the word go.
Wow, that's good. That's good. And why Pretoria?
Why Pretoria? Hubby was working in Pretoria.
Okay, all right, yeah. Now we understand. So he was in Pretoria, so you wanted to be closer to hubby.
Yeah, because when I was in Brett, we had to move to Brett, and hubby was traveling almost daily from Brett to Pretoria, which can actually be a bit much. So we're like, okay, no, let's come back so that he's also closer to his workplace and I will be closer to my workplace. Yeah.
Wow. Okay. All right. No, that's good. So you in January this year, you published an article, or it's an opinion or an article about your journey into general surgery. That's where you talk about what happened in your first day, where people were questioning your wisdom, being a female, to choose to be, in a male-dominated field. They actually gave an ultimatum of 3 months. All right. And then you also talk about some professor who made fun of you. They looked at your small frame. They even measured, your mid-arm circumference, and said, how can you even think of being in surgery when you are so small? So your experience, just tell us a little bit about your experience in joining the field of, general surgery, the discouragement that you were getting from almost all the corners, others even accusing you that maybe you just want to spend more time here at the hospital because there are problems at home. Yeah.
Yeah. Back at the time, that was in 2010. So at the time, there were still very few women in surgery. And I remember that time we used to be told that, surgery is not for sissies. Sissies don't really last in this field. Understandably so, looking at the history of surgery, it used to be a male-dominated discipline. When I started, my son was about 10 months old. Then I got there, obviously you introduce yourself. Okay, I'm a wife, I'm a mother. And already from that, they start giving you looks. It's like, what are you doing here? This is not for married women. This is not for mothers. This field is for men. It's like you spend most of the time trying to explain why you are there in the first place. And obviously, like in my case, I was told that I wasn't going to last 3 months because there were other people who came before me who never lasted for 3 months. Not only women, men too, because of how hectic it was. Because like what is common with surgery is that you spend long hours at work. You start early, sometimes you finish late. Obviously that can discourage other people. It's like you don't really have much of a social life when you are in a surgical discipline, especially as a trainee. So for me, I remember that I told myself that, I know it's just temporarily while I am still a registrar. There is definitely going to be life beyond registrarship. When I become a specialist, I will be able to catch up with some of the things that I might have lost during that time of training. So yes, you get looked down upon simply because you are women. You get looked down upon because of your size. In some cases, even the color of your skin. But what is important for one to remember is that your dreams are valid. And your success has got nothing to do with your gender, has got nothing to do with the color of your skin, it has got nothing to do with your size. If that's what you want to pursue, if that is your dream, the minute that you can see it, you can visualize it, just know that you can achieve it. So it is up to you to make sure that you work towards achieving that goal. So that's the thing that actually kept me going, the goal of becoming a specialist surgeon, such that even when they were saying, they were throwing those negative criticism towards me, I decided to just turn a deaf ear to it and focus on where I want to be, which is becoming a surgeon. The other thing that I mentioned in that article, I actually forgot about that article, was that some of those negative comments, like when I won't mention his name, at the time when he measured my arm and talking to his register, I was just wasting my time. I could have just chosen a female friendly specialist than wasting my time in general surgery. So that made me realize that actually there were many people who were waiting for my downfall so they can say, we told you so. Surgery is not for women. So I use that to my advantage. I use that to encourage myself that, you know what, there are many people that are waiting for your downfall. Prove them wrong. Work hard, pull up yourself, work hard, and prove them wrong. So since that time, I look forward to that day where I have qualified, I've got that certificate, and I'll go back to that professor and show him that this is what I was able to do. And that's exactly what I did. It's a pity that since then, he couldn't even look me in the eye because he was still in shock that I actually did made it to the end. Yeah. Despite my size, despite my gender.
Yeah. And then there's also something that you talk about, Doc, about the, I mean, there's a lot of reading and you write your primaries and all of that. And, when people look at the successful Dr. Phakathi, they will not know that at some point, she tripped a little bit, when she was doing her primaries for the MMed, but you know what? She used that and went and wrote the primaries for the fellowship. And you actually did well there. So the message there that, when you trip and have a little bit of a failure, it is not failure if you stand up and continue going forward. But if you then remain sitting down there, then yes, it is failure. So can you talk a little bit about that experience and how it actually, made you to even work harder, because it was something that was sort of working at validating what these other people were saying about you. So when you didn't get those two subjects, then they were like, yeah, we told you.
Oh. Yeah, it was a painful experience because at the time it was the first time I had failed in my life. I remember I cried. I really thank God for my husband. I think he's the reason why I was able to get up. Because for me, then I started all those negative things that my colleagues used to say. Now it's like they were really fresh in my memory. I started entertaining them that, what, maybe they're correct. Surgery is not for women. I think the fact that I failed, it was actually physiology and pathology at the time for MMed. I was like, I think this just proves that I'm in the wrong field. I should consider maybe choosing another field. Then at the time, I remember my husband, Shame, he's been so supportive. Like he tried by all means to speak sense into me, encouraging me, and like just emphasizing the importance of me getting up, obviously learning from the mistakes that have led to me failing, and also using that, learning from those mistakes, correcting them, getting up and going going for this examination the second time. I remember after that, he told me that this time around, you are going to make it. That time, it was so difficult for me to actually accept because I remember some of my colleagues, I was told that some they had to write that 3 times, 4 times. And I could just not visualize myself going through the same thing 3 times, 4 times. But then my husband told me that, you know what, you are not them. Just because that's what happened to them, you are not them. Focus on your journey. look where you've gone wrong, correct it, go and write this exam again, and you'll definitely make it. And that's actually what happened. I think that gave me a boost.
All right. So fast forward to 2014, you qualify as a general surgeon. You're now accepted as a fellow of the College of Surgeons of South Africa. What did it mean to you?
Wow. Yeah, for me, it was like a dream coming true. And also the fact that I was able to finish within the expected period, because in Pretoria it was 5 years. So yes, I was still able, despite those failures, I was still able to complete within that specified time. So for me, I think it made me realize that my hard work over the past 5 years, the challenges, the obstacles that I encountered in those 5 years, they were not meaningless. I think just being able to get to see your dream coming a reality was something that was, I felt fulfilled. I really felt fulfilled. But then at the same time, I had to ask myself, what is next? Yes, I got what I've always wanted, but then what is next? And also for me, that proved that, you know what, it doesn't matter who says what. Your dreams are valid, and as long as you work towards fulfilling those dreams, you can do it. And also it was more of a reassurance that gender has got nothing to do with whether you make it in surgery or not. If you want it, you'll get it. Therefore, you must go for it.
Beautiful, beautiful. I've got a few comments that people are already making. So I'm going to ask Nwabisa, who is my support, to just read a few of those comments before we continue with our interview. Right.
Good afternoon, doctors. Can you hear me, Doc?
Yeah.
Okay. So we have a couple of comments. One from YouTube, written by Nomfundo Masikane. She wrote, "What an inspiration she is, Dr. Boitumelo Phakathi," with a couple of praise hand emojis there. And we have other comments on Facebook from Mandla Hadebe. He wrote, "Well done, Dr. Boitu. Of course, I recognize the picture behind, as I was there on that big day." And then we have a comment from Unkareng Matsilo, who wrote, "Blessings, Dr. Jumi." And two comments from Siamo Motate. She wrote, "Being humble and bringing others up is something Dr. Boitumelo embodies." Another comment from the same person. "I'm someone from Taung, and I confirm that what she said about her younger self is true." And we have another comment on YouTube from Osingiphile Ngumalo. She wrote, "We are so proud of you, Dr. Phakathi." And another comment from Asilia Malifane. They wrote, "Your dreams are very valid," also with emojis of hearts and flowers there. And another comment from Nokukanya Makumalo. They wrote, "Dr. Phakathi is such an inspiration." We have three more comments. Should I continue, Doc?
Yeah, just finish them, then we're going to proceed.
All right. Okay. Another comment from Siyamo Motate wrote, "It doesn't matter who says what. Your dreams are valid. Gender doesn't have anything to do with it." And then another comment from Tozama Siyotsula wrote, "Such excellence." Muketwa Zikane wrote, "She's a hard worker. Well done, Doc." Another comment from Tozama Siyotsula again. "When is the best time to start PhD after specialist qualification?" So that's a question. Yeah. Also, Ngaring wrote, "Dr. Dumi, from grade 5, she was promoted to grade 7. That's so inspiring." And
so she skipped it.
The last comment is from Nkensani Yvonne Chauke. "Boitumelo Phakathi is such a phenomenal leader, genuine and wonderful person." That's what we have right now. Thank you.
Thank you very much. Doc, do you want to take those?
Thank you very much.
You don't need to do the questions. You can answer. The comments are just for you.
Okay, awesome. Thank you for those beautiful comments. The questions, should I start with Dr. Mukhera's question?
Yeah, well, you can start with it. Yeah.
Okay, Dr. Musa Mukhera, thank you for the awesome question. He's my brother and we fight a lot. You know, when you're married, it's not a clear-cut question answer kind of thing. Like, remember, I'm married to Phakathi, who's from KZN, so I need to be considerate when making a decision as to when I go back to Northwest, where will he be in this picture? So it's not really an easy answer to say as to when I'm gonna go back there.
Yeah. No, and I mean, you don't have to physically go back there, because in what you are doing, you could actually do things that will benefit home. So what I'm trying to say is, you know, you don't have to be physically there. You could support, you know, programs, you know, or centers of excellence or whatever that will benefit the people of Tao.
Very true, very true. I think that's why when you mentioned the Education Foundation, that's why the career expos were being done there, trying to, to empower the young people back at home. But as far as medicine is concerned, yes, to offer support, I can do that. Okay, obviously I do have some plans lined up, but obviously I cannot go back and physically work in the Northwest for reasons that I've mentioned. Yeah.
And he's got another question, so that I just finish his question. He said, what's your view on decentralization of specialized medical services? I will watch the recorded interview. So yeah, so he's not live. He sent me these beforehand. So what's your view on decentralized specialist services?
Okay, that's a good question. Like recently, 2 weeks ago, we started a breast unit in Polusong Hospital. I am one for that, whereby it is very important that we empower the regional hospitals, we empower the district hospitals, the primary health care, as we're now preparing ourselves for the implementation of the NHI. Like, for instance, I had the breast unit at Salamatlake. So we started a breast unit there. It's one of the ways of decentralizing the breast care service, where we're taking the service to the people who really need it. Like, for instance, many patients have been coming from the eastern regions, coming to Charlotte Matlake. I mean, that on its own, it's a distance. Sometimes some of these patients, they have to take more than 2 taxis just to get there. So now, by decentralizing, taking the service to them, you are already doing away with the barrier that the distance can create to healthcare, to the patient seeking healthcare. And by doing that, we encourage, this will in turn encourage patients to present early whenever they have breast-related problems. And as a result, we'll be able to, for instance, diagnose breast cancer timelessly and even be able to treat timelessly. I am one for the decentralization of the healthcare services.
Beautiful, beautiful. All right.
And when you decentralize, don't just decentralize, you need to also offer support, even if it means you are physically there you are transferring those skills until that hospital that you might have chosen, they're actually able to carry on with what you have implemented there. And in a case where you are not physically there, still offer that support, still be there, because it's not just about starting up something. You want to start something that will continue even when you are no more.
Beautiful, beautiful. All right. Do you want to take any other questions that are there that were posed?
Okay, as Dr. Siotula Tozama, she asked about when is the best time to start the PhD. The best time is when you are ready. When you are ready to start the PhD, my advice would be, think beyond just the PhD. The question that you need to ask yourself is, why are you doing PhD? Where are you going? Are you doing PhD as part of you becoming an academic, or what? Are you seeing yourself as a professor, as an academic, a professor? Because once you ask yourself that those questions and you are able to answer yourself, so then it will also inform you that while you are there doing that PhD, you shouldn't just focus on that PhD alone. Do other things that will help you get there.
All right. And on that point, you did your PhD. Is it done and dusted?
It was marked recently. I'm busy with the corrections. It's passed with minor corrections. So yeah, almost.
Okay, all right. No, that's good. You are there. All right, and so there is a new generation of medics that's coming up, in a generation of what we call clinician scientists. You know, people who go into research to solve some of the day-to-day problems they pick up during their clinical practice. Bit of a challenge because they have to then, divide their time between research work and also doing clinical work, and for you, because you are there anyway. So how are you able to juggle that?
So for me, my PhD was both clinical as well as lab-based. So when I was doing the clinical work, I was still carrying on with my clinical work because it was easy. It was something that I do on a day-to-day basis. The data was just there. The challenge came with the laboratory work, whereby now I had to leave my clinical responsibilities and focus entirely in the laboratory. And that was made possible by the scholarship that I got, the Prof. Bongani Mayosi's clinical scholarship,
Yes.
whereby during that time when I was in the lab, they took care of my salary. So
Yes.
what I've seen colleagues, the truth is it's not easy to juggle up. That's the reality. That's the reality. And the other thing is that when you resign from your position and do PhD full time, you are not guaranteed that position when you are done with the PhD. Remember, I mentioned that one has to ask herself or himself that why am I doing the PhD? In a case whereby you resign to focus on PhD full time. Remember, if your vision is to become an academic, a professor, vice chancellor, whatever the case may be, just remember that when you are doing PhD full time, it might not necessarily be easy for you to push the supervision of the masters to continue with the teaching. Obviously, the clinical service delivery is you are not fulfilling that anyway because you are now doing the PhD full time. So my advice would be, don't resign. Don't resign. Find a way to juggle up, even if it means you get maybe a 1 year time off, just to focus on the PhD. You take a sabbatical, do that, but don't ever think of resigning. I was once at that point, but I'm glad that my mentor advised against that.
All right, so you are one of those people who are multiplying. When we say, Prof. Bongani Mayosi is gone, but he had that 1,000, PhD, vision or program, and you benefited in a way, from that. And so, whilst he's gone, but people like you are actually taking the baton, and we are moving forward. Right. So you did your general surgery, but then you now have become somebody who is known a lot around research work on breast cancer and HIV. Breast cancer and HIV. Can you just tell us what made you to zoom, from, you could have been a head and neck surgeon or foot surgeon or whatever surgeon, but you now decided you want to focus and bring new knowledge on issues relating to breast cancer and HIV. Breast cancer being the most common cancer amongst females in South Africa and in fact the world, and in a country that has got just over 7 million people who are HIV positive, with the biggest load of HIV positive people and the biggest ARV program. So just tell us a little bit why that.
Why that? That's a good question. Thank you for that. So for my master's, that's the topic I was given: breast cancer and HIV. So at the time we realized that okay, these two are sort of the areas of interest, like you've mentioned, breast cancer is the commonest cancer among women globally and even locally. And then the HIV, South Africa, I mean, it carries the largest burden of the disease worldwide. So the thing is that at the time, there was still a lot that was unclear as far as breast cancer and HIV are concerned. Because at the time, people thought if the patient has got both breast cancer and HIV, we need to treat them differently. Maybe we need to be extra careful. They might be prone to getting the complications from the surgery or side effects from chemo or radiation therapy. There were a lot of unknown answers at the time. So that's when we embarked as a way to try to unpack that. And then from the masters, obviously, I had a small sample. So for my PhD, I decided, I'm taking this further. I won't just want to know about how the breast cancer and HIV present at the clinical or pathological level. Let's look at it at the genetic level. But why the genetic level is because, yes, breast cancer, it is breast cancer, but we know that it behaves differently. It responds to treatment differently based on the genetic makeup of that particular cancer. So yeah, that's what drove the passion. And so far what we found was that, okay, I'm not going to talk about the molecular lab findings, but so far what we know that just because a person is HIV positive, there's really no need for you to treat them different from someone who's HIV negative. And also the fact that you are HIV positive, it doesn't put you at risk. HIV is not a predisposing factor for breast cancer. We know HIV, it is a predisposing factor for cervical cancer, but when it comes to breast cancer, it is not the case. Yes, we've seen that women who are HIV positive, when you compare them with those that are HIV negative, they tend to present at an advanced stage of the disease. That we know, it's confirmed locally and even internationally. So it's just for us to know that, okay, for this patient, obviously, anyone who presents with an advanced disease, we tend to be a little bit aggressive in treating them. Okay, and also in terms of the the biology, the tumor biology, the HIV does not influence that. And also in terms of the surgical complication, HIV positive patients are not prone to get the complications following surgery. Yes, we know with chemotherapy, some of them, they tend to be more prone to get some side effects, but I won't go into much details. But yeah, that's what we know so far.
Yeah, and in fact, as I was researching you and looking at some of the research work that you've done, one of the research that you did it with my mentor when I was still at medical school, Prof. Taule Mukwena. You published this one in August 2016. It was the effect of HIV infection on this surgical, chemo, and radiotherapy options, of oncology management. So I just wanted to mention that, name dropping there, that, Prof. Mukwena that you worked with is one of the guys who helped me a lot, especially when we're getting ready for the final exam. He would take us to the wards and, just, sharpen our skills before we could then go for that final exam. A guy who I really like, and he went to the same high school as myself at St. John's College in Umtata. So he's a guy I've got a lot of respect for. And you mentioned now something about, and another research that you did, that you found that people who are HIV positive, women who are HIV positive, they tend to present at a younger age, and also they tend to present with more advanced disease. Any particular reason for that?
With regard to the age, when you look at the population, the HIV positive population, that population in general, they are young. So it doesn't necessarily mean when you are HIV positive and you do get a breast cancer, it doesn't necessarily mean you'll get the cancer much younger than someone who's HIV negative. I think that's the conclusion that we could come up to.
Yeah.
That's why for the molecular work, we did try to age stratify patients.
All right. Now, coming to the issue of genetics, obviously, this is stuff that is PhD stuff. You can't release the results or whatever now. But we know that there are those BRA1 and 2, genes, which are sort of a predictor, especially if you've had a first degree relative who died, from cancer or who had cancer. So you've got that Angelina Jolie situation. I just want your thoughts around that, the radical mastectomy, which is more of a preventative thing, because you've tested positive for those genes. Do you advocate for that, or do you think it's something that people shouldn't really be doing?
Obviously, with that, we know that when one has got a strong family history of breast cancer or even ovarian cancer, and especially if the relative got the cancer at a much younger age, we tend to worry about the risk of them being a carrier of either BRCA1 or BRCA2 gene mutation. So in a case like that, we send the patient for genetic counseling and the test gets done. In a case whereby the patient now has got that confirmed mutation, obviously that puts them at a much higher risk than someone who does not have that mutation, for them to develop either breast or even ovarian cancer. So obviously, once we get the result, we sit down with the patient, obviously with the help of the genetic specialist, and then we look at the ways. We look at the ways of trying to prevent. They call them risk modifying strategies to prevent them getting the breast cancer. In some cases, yes, bilateral mastectomy is one of the things that we do, but in some cases we tend to observe, to watch them very closely, whereby we'll start the screening process much earlier, and in some cases we might even be forced to even not just do the mammogram but also add a breast MRI, so that you are able to pick up the cancer while it is still in its early stage.
Beautiful. All right, the last one from me. There's a few other comments, from people, but the last one from me. There is also another study that you guys published in October 2018. Clinical pathological characteristics amongst SA women with breast cancer receiving ART for HIV. Now, at a simplistic level, treating patients with breast cancer who are HIV positive, does one have to do it differently? Is there anything unique in the ARV therapy of, people who are HIV positive, qualifying for ART? Obviously, nowadays, everybody gets to be given ART, and who have got breast cancer.
Okay, good. So at the time, not everyone who's HIV positive qualified for the ARTs. But then what we do is that when we know that the patient has got cancer, remember, like some of these patients will have to go for chemotherapy. So we tend to send them to the ART clinic for them to get started on ARTs, because we know about the side effects of chemotherapy, for instance, like we know what it does to the immune system. So now we wouldn't want a situation whereby, yes, the HIV has dropped the immune system and here's the chemotherapy also adding to that. So we'll send them for the ART initiation, so that at least it sort of helps with the improvement of the immune system, such that they don't really such that they don't get they cope with chemo. But yes, we know that some of them, they'll still be prone to side effects of chemotherapy simply because of their HIV status. So what we do is that the ART regime, it stays the same. We do not change. We do not change it. We actually encourage patients that they must start the ARTs, because what we have seen is that with the paper that we published now in June, we actually saw that the patients who are not HIV positive patients who are not on ARTs, they tend to present also at an advanced stage compared to HIV positive on ARTs. And also they tend to have, those not on ARTs, they tend to have a poorer overall survival compared to the HIV positive women who are on ARTs. But what we do not know is it the direct effect of the ARTs on the progression of the breast cancer. It's not something that still needs to be explored further.
Beautiful. All right, let's read the comments. Nwabisa, can you read some of those comments, please?
Okay, Doug. The first comment is from, can you hear me, Doug?
All right, we can hear you now.
Okay, so the first comment is from Siamo Motate. She wrote, Dr. Boitumelo Phakathi is actually doing amazing work in Taung through the Taung Career Development, as well as the Boitumelo Phakathi Education Foundation. And another comment is from Duncan Manyonda. He wrote, with all these achievements, I feel Dr. Phakathi is a global brand. Have you ever thought about this? And another comment from Salome Maswime. She wrote, a phenomenal woman, leader, and surgeon, has achieved so much in her career and self-driven and motivated. Siamo again wrote another comment. Dr. Boitumelo is a patient able to come consult with you regarding their breast health, even though they are not necessarily HIV positive? If so, where can these patients come to consult with you? And a comment from Samuel Danguru. He wrote, very acknowledgeable and inspiring, Dr. Boitumelo. Last two comments from Tozama Siotula. Wrote, great research. We look forward to more publications. And then the very last comment is from Duncan again. This one, he's replying to Samuel Danguru saying totally agrees with what he wrote. Thank you very much. That's all we have.
All right, thank you. All right, Doc, is there any comment or answer do you want to give to some of those?
Wow, beautiful comment. Regarding me, see myself as a global brand.
Taung stand up. Taung must stand up. You are a global brand. You're coming with cutting edge, knowledge around breast cancer and interaction with HIV, stuff that has not been, done before. So obviously, you are going to be, if you're no longer, if you're not already a global brand.
Yeah, I think it's still a work in progress. I still have a lot of work to do to get there. But yeah, thank you for that comment. It's actually an Apostle Manyonda. Okay. Regarding if patients who are HIV negative with breast problem, obviously, for me, I see anyone with breast-related problems, whether HIV positive or negative. I see them all, I treat them all, and I treat them the same way.
Maybe the question there, Doc, just a question there. I know you work at Charlotte Maxeke, you're heading the breast and endocrine surgical units there. But maybe the question is, if people would like to see you for other breast health related issues, where can they go? Do they only have to see you within Charlotte Maxeke, or, because I see that you've got Rapper Breast, breast center or something like that. Maybe you can just talk about that.
Yes, I do sessions in private, Busamet, but I only do breast-related diseases, yeah. Medical management, surgical management of breast-related problems in Busamet, and obviously I'm full-time at Charlotte Maxeke.
Beautiful.
And in Busamet, it is under the name Rafa Breast Healthcare.
Right. But that also does your outreach work, awareness programs and stuff. The Rafa Breast, entity, does a lot of work beyond just seeing the patients, but more on the education and awareness side of things.
True.
Okay. All right. Any other comment that was there? I was very happy to hear about Prof. Salome Maswime, as the president of that clinician society, I know that you're one of the leaders there. And I've been there 2018 for your awards, 2019 for your awards. And unfortunately, because of COVID, you guys didn't have them last year. Are you planning to have them this year?
I'm not sure. I had to take leave from the society. I used to be the vice president of the South African Clinician Scientist Society, but then when the workload of the PhD was getting too much, I decided, okay, now let me just take a break and then focus on this. As for the current plans, I'm not really sure.
Okay, no, I'll ask it because people need to be, recognized every year. All right, maybe they can just be virtual, but it must continue. But she's doing great work, and you guys have started something that is really good, and so may that momentum not end, because I found that quite a number of people were being recognized and rewarded there. It gave them more impetus to actually even go and do better. So yeah, it must continue. So let's now look at the current situation, right? You are almost done with your PhD. You've decided that you want to be a clinician. I mean, you are a clinician scientist. You want to be a prof. You want to be an academic, and one day to be a boss of academics, as a VC. Academics and everyone else within an institution. Do you have any particular institution in South Africa that you would like to be a VC of? I mean, I'm just throwing it in G.
KZN, UKZN.
UKZN. So you want to follow Ungoza? Oh, no. Ungoza is the dean. So you want to be for the whole university. It's attainable.
KZN, so why not?
Wow. Okay. All right. But anyway, the choice to become an academic, it comes with its own downside. Academics don't make a lot of money. So when there's black tax issues, it might become a challenge, So, and please, those who are academics, they must not fight with me now. But I'm just putting it out there that, the prestige of academia means you need to sacrifice on other things. Can you just talk about that in terms of decision making? Because you said people, when they are going to do a PhD, they must ask themselves, what do they want to be? Do they want to be professors? Do they want to be academics? Because choices have got consequences, whichever choices. If you want to choose to be in the private sector and make money, but then there's also sacrifices there, you can't be able to do both of them properly.
No, that's true. That's the sad reality of academia. I think that's why we end up doing sessions in private to try to fill that gap. But the thing is, for me, I love academia. I love teaching. I love teaching, teaching the undergrad, postgrad, supervising in research. It's something that is very close to my heart. And I think being in private full-time, that's one thing that I'm going to miss. I've seen colleagues who have gone to private, they've been doing private full-time, coming back to the academic setting, simply because they are missing that academic setting, that teaching environment. Like you mentioned, there are sacrifices on both sides. So the question is, what is it that you are willing to sacrifice? But obviously, it doesn't really necessarily mean that you'll have to the sacrifice that you are making now, they are eternal sacrifices. It might just be temporarily while you're still establishing certain things. And obviously still in academia, there are other ways of also making money, like publication. There is a concept of academic entrepreneurship. There are so many ways. That's why when you are there, don't just corner yourself. You need to be out there and network, see what other people are doing. We know of academics who are really making a lot of money through this research, through the publications. You just have to know where to go, who to talk to.
Even in this space of cancer management, there's a number of foundations that are making a lot of money, on the breast cancer side, on the prostate cancer side. So it's possible still, whilst doing the good work of research, to actually, create partnerships. I think what then becomes important is, how do you keep your independence so that, people do not see you as working for pharma, exactly. Because then that sort of, discredits you in terms of objectivity and stuff. So there's a balance there that I think needs to be maintained. So I mentioned that you said some of the three things you wanted to work on was improve your ability to teach. What is it about your ability to teach that you think needs to be augmented? Leadership. What is it about your leadership that you think still needs to be, improved? Just those two things.
Okay, so obviously when we are training to become a surgeons, remember you have been trained to be a surgeon, a clinician, whereby you are rendering a clinical service. But then the other aspect to it is teaching. Yes, many a times we do teach, but in some cases you were never taught on how actually to teach. Yes, we give tutorials, so it is very important that as you teach, you get to hear what the students think about your teaching. Usually through the assessment, you are able to see in which area you are still lagging behind. Obviously, when I wrote that was like years ago when I just started. But now, yes, there is a huge improvement as far as my teaching portfolio is concerned. So it's all about improving your teaching skill, making sure that the message that you want to deliver gets understood, it gets received, and it gets it gets implemented. And also, obviously, with leadership, yes, some people, they believe that some leaders are born, blah, blah, blah. But I'm one person who believes in working. I believe on working on myself, working on improving myself. As far as leadership is concerned, yes, attend those workshops, leadership workshops, read the books talking about leadership, and sometimes just learn from the leaders, from your seniors, on how they do certain things. Yes, I'm still a work in progress, because I know in order for one to become a professor, they do take those things into consideration. Yes, we are clinicians, but when you apply for that position, they will want to know, are you just a surgeon who's interested in surgeon, or you are a surgeon who's interested beyond general surgery? So they look at the things like, in terms of clinical service delivery, how are you doing? Teaching, how are you doing? And for you to know how you are really doing, it is through the assessment, being assessed by the undergraduate student, postgraduate student, and even by your peers. Because that's when you know that, okay, I am in the right direction. If you're not in the right direction, then do something to make sure that you are doing well. And there is some progress, there is some improvement in what you're doing.
Yeah. All right, Doc. We have only 15 minutes to go, because we take 90 minutes. So we've only got 15 minutes to go. The award that you received, about a month ago, on the 9th or 10th, at the virtual conference of surgeons, what does it mean to you?
Well, it was so unexpected, to tell the truth. But for me, it was sort of comforting at the same time, considering how difficult it was during this PhD journey, the obstacles, the delays that were far beyond my control. Seeing that it sort of reassured me that all that I went through was not for nothing. Okay, my hard work, at least it gets recognized, even though when I presented, I didn't present with the prize in mind. It was just a matter of me sharing what we have done. But when that prize came, I was like, oh my goodness. So it does show that, yes, the hard work that one has done didn't go unnoticed. And the fact that they're actually, they're going to, when we do publish the findings of this, of the molecular work, they're going to take care of everything. Before the COVID, obviously, one will be given an opportunity to go overseas and present at this very same work. But now things have changed, now that we're doing things virtually. But at least now I don't have to worry about the funding for that, for publication. As you know, that to publish is quite expensive. So at least that is covered.
Beautiful, beautiful. All right, so what's next for you? You seem to have achieved so much. You've worked so hard. I think, the professorship, I think it's just a matter of time for you to get that. And the vice chancellorship, I'm sure you will get that as well in not so distant future. So, what's next for you? Besides
rest.
How?
Yes, I need to rest. I know Prof. Masima asked me the same thing, and then I said, no, I need to rest. And he was like, what? Rest? Rest, yes. And then obviously she said, I mustn't rest for too long.
Yes, well,
So
you may
yes.
just get too comfortable with rest, you know, and lose the momentum. You've built up a very strong, you know, momentum as a clinician scientist, and you know, we're still waiting for more. There's still many questions to be answered around breast cancer. Still many questions to be answered around the association with HIV, and who better to come up with the answers to those questions than you?
Yeah, the immediate plan is rest. Obviously, intermediate, there's more coming. I'm currently supervising MMETs. So the idea is really to push that, improve on my research output. Obviously, we're still working towards that goal, the goal of becoming a professorship, and to even become a VC. There's still a lot of work that still needs to be done. The one thing for sure, I am not going through the postdoc fellowship. There are other things that I want to venture on that I can't disclose now, but yeah, there are plans. There are plans put in place, but immediate phase, I need to rest. That I really,
All right, let's switch from the academic and everything to the Mami Roots part. I saw, you know, Dr. Zama, the pathologist, you know, she's my Facebook friend. So she was Mam Ruti to another Mam Ruti, pathologist to a general surgeon. She was giving you big ups, you know, when you got that award, you know, from the surgical community. So how do you juggle being Umam Fundis, Mamuruti, and everything else that you are doing?
I like the question. How do I juggle up everything? It goes back to God. You know, God, you know, like God has been amazing. He's able to just, I think he's the one who's given me the ability to be able to do what I do. The other thing is the support structure. It is very, very important. Obviously, I cannot do it on my own. Like in my case, my husband has played a huge role in enabling me to be where I am today. I think that's why it is also very important that I'm also there, present for that ministry. And also having a good helper at home, whereby while now on Saturday I'm at church, making sure that things are running smoothly, I know that my kids are being looked after. While I'm at work doing this, I know that my kids are being well taken care of. And obviously the family, I've got awesome friends whereby, you know, like they're always there, encouraging me, motivating me. Obviously, there are times when you really get tired. Once I hit that moment, I know that, okay, to me, just stop everything and rest. Something that I never knew back in the days until a point whereby, but yeah, I had to learn to also, in the midst of all the busyness, to find time for myself just to rest. But the support structure, it is very, 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 very crucial.
You know, when I looked at the same question was asked to you by somebody else, and you said, you know, it's God, it's general surgeon, and then the rest. So basically, it's always God first, which is how things should be, because the talents and the gifts and opportunities and everything else, I mean, he's created those. So I was actually impressed with that. All right. Let's just hear if there are any last comments before we close. Nwamisa, are there any last comments? In the meantime, Doc, a message to the women of South Africa and a message to up-and-coming medics who would like to follow on your footsteps. All right, Nwamisa?
Yes, Doc, we do have a couple of comments. We have one from Bulelwa Kwakwa. She wrote, yes, you are. Don't doubt yourself. And then another one from Ndokozo Nomaswazi. She wrote, yes, our sister-in-law, with laughing emojis there. And another comment from Duncan Manyoda. He wrote, with the knowledge you have, you just have to be more visible in universities in Africa and beyond. And we wish to see you more on national television. Your calling is unique, Doc. And then we have another comment from Kosingipile Ngumalo. Congratulations once more, Dr. Boitumelo, on all your achievements. Thank you, Dr. Fundi, for bringing us a dynamite and shining star. I am so inspired. The last comment from Tiamo. God first. Thank you for that, Dr. Boitumelo Phakathi. Okay, another comment just came in from Solomso Menzi. She wrote, "It seems like I joined late," with a crying emoji there. Thank you very much. That's all we have.
Yeah. All right, Doc, I think those were just comments. I didn't hear of a question, but if you had a question, you can answer.
I didn't hear the question myself, but yeah, I sincerely appreciate all the beautiful comments, encouraging messages. Wow. I'm even getting emotional. But yeah, no, thank you very much. And going back to the question that you asked, my message to the women in the country and also the upcoming female surgeons is that we must not let anyone look down upon us simply because of our gender, simply because of our race, simply because of our sizes. Our background, our place of birth does not determine how far we can go in life. We must just remember that we've got this. Our dreams are valid. We shouldn't let other people's limitations limit us from achieving our goals. And as we rise, we need to remember that we rise by lifting others up. You don't just want to be the only one rising, because when you are there at the top, it will be lonely. So make sure that as you rise, you bring others up also. Most importantly is that after you have succeeded, I like what Michelle Obama once said, is that after you've gone through that doorway of success, make sure that you don't slam shut the door behind you. Leave it open so that you can allow other women to go through that very same door. You look back, you pull them up, allow them to walk through the same door of opportunity that you've walked through.
Beautiful, beautiful. So to the young medics or the reps who have just started getting into your field, or any field for that matter, of medicine.
Okay, one thing for sure, especially as a woman joining the surgical discipline, now things are a little bit easier, but don't let anyone doubt you. Don't let anyone doubt you simply because you are a woman. Remember, it takes more than just the XX chromosome, XY chromosome to become a surgeon. If surgery is what you want to, becoming a surgeon is what you want to become, work hard to make sure that that becomes a reality. Yes, there will be obstacles along the way, but remember your why you are there in the first place, and keep the focus on the ultimate goal. It may be rough during the training, but there's definitely life beyond that registrar time. Okay, so Doc, you grew up, it was church, and in your adult life, you got married and became Mamuruti. So what's your favorite scripture? You know, the one when you are going through difficulties or challenges in your work, and you just take this scripture, it just puts things into perspective. It gives you, more energy to go forward. It gets your faith, reignited again. Just that favorite scripture, and maybe favorite hymn. For me, what I like to say is that just knowing that God is with me all the time, God is for me. It does not matter who fights against me. I even read this in the morning at church, Jeremiah 1 verse 19, when he says, they will fight against you, but do not be discouraged, do not worry, for they will not overcome you. I will rescue you because I am with you. I think that reassurance of knowing that God is with me and for me, it helps me that no matter what I'm facing, no matter what I'm going through, I know that I am not alone in that. Beautiful. Do you have any nice, what I call it now, either a hymn or, gospel song or whatever? You remember you were in the choir for a long time. So to hear a little bit, I'm just being naughty now, Doc, but anyway, that shouldn't be a difficult thing to you. No, let's not go there. When I was in the choir, I was still young. I didn't know what I was doing. My husband would definitely disagree with me singing. Oh my goodness, yeah. No.
Oh, let's leave it. Let's leave that talk. I was just being naughty. But thank you very much for giving me 90 minutes of your time, very precious time, family time. And thank you to Uputsbomseni, that is Uhabi, and also the kids, for actually, allowing you to spend 90 minutes talking, about your journey. At the beginning, I could hear them, talking at the back and screaming there, so please say thank you to Habi, thank you to the kids, but more importantly, thank you to you, and may you continue to do the good work that you are doing. Looking forward to, seeing a post of you getting your PhD, wearing your red robe. Looking forward to you being a VC in some, university, in the period of not more than 10 years from now. What is in my mouth will certainly manifest. I believe that you are in line with your life purpose. So those things are going to be, a reality. There's one last comment. It's a comment, it's not a question. Nwamisa, do you want to read that comment?
Okay, Dr. The comment is from Dumimoloi. I wrote, thank you so much for such a great interview. We love and appreciate you, Dr. Phakathi. Thank you.
Beautiful, beautiful. All right, thank you very much to everybody who joined in and followed this conversation. I hope you were inspired. If you were facing difficulties in your work environment, patriarchy making life difficult for you, or racism making life difficult for you, or other women pulling you down, making it difficult for you, may you be, encouraged by the story of Dr. Phakathi, because when you go through challenges, they actually help you to grow. You won't grow if you didn't go through challenges. So don't always look at challenges, as something that stops you from going for your dreams. Sometimes they actually sharpen you so that you can attain your dreams sooner. So thank you very much to everybody, and till next time.
Thank you, Doc. Thank you, Nwamisa, and all the listeners.
Thank you, Doc.